Hello students, this question session for anatomy and physiology portion. Let's start. Most of the absorption of fats occurs in the jejunum. Jejunum. What were the effects of thalidomide on pregnant women when it was used to treat morning sickness during the 1950s? Limb deformities. deformities. The glucagon is accelerates the conversion of glycogen into glucose. Intrinsic factor is secreted by parietal cells. Inkic Ali is at risk of diuretic induced hypokalemia. Which of the following food that has the highest content of potassium would you advise him to consume? Banana. What is meningitis? The tissues that overlay and protect the brain and spinal cord. Inflammation of meninges. Coronary sinus develops from sinus venosus. Chemical breakdown of food is because of acids and chemicals. Acid that is found in our stomach is hydrochloric acid HCl. The portal vein is formed at the level of second lumbar vertebra by the superior mesenteric vein by the splenic vein. All of the above. The amount of blood that is ejected from the heart in one concentration is called the stroke volume. Which nerve is most likely to be injured in fracture of shaft of humerus? Radial nerve. The major function of ciliated epithelium present in the uterine tubes is to facilitate movement of ova in uterine tube. Which of the following structures is likely to get damaged when the semiflexed lateral meniscus? What is the number of floating ribs in humans? 2 pairs. What is the site of hematopoiesis in an embryo? Yolk sac. The structure that is located near the laryngopharynx to prevent a food balls from entering the airway during deglutition is the epiglottis. Number of extrinsic muscles involved in movement of the eyeball is 6. Shortest part of the colon is ascending colon. Conjoint tendon is formed by internal oblique and transversus. Mr. Sam was complaining about the pain at his right hypochondriac region, which refers to a region of the abdomen. The buildup of plaque. in the arterial walls is called atherosclerosis. Division of human eggs is holoblastic and unequal. Melanin, responsible for skin color, is secreted in germinative layer. The serous membrane that lines the organs of the digestive system is called visceral peritoneum. The products of the body's endocrine glands are hormones. The puberty hormone that stimulates the male testes to produce sperm and stimulates the development of the follicle in the female on a monthly cycle is follicle stimulating hormone FSH. What is an embolism? A circulating blood clot that becomes lodged in a vessels. Largest joint of the human body is hip joint. Base of the heart is formed mainly by left atrium. Structure and motility of the cell is maintained by microtubules. Structure refers to dry scar or slope formed on the skin as a result of burn. Excessive hemolysis may accumulate this substance in the body. Bilirubin. What is the two basic types of leukocytes, phagocytes and lymphocytes? The nucleus located deep to facial colliculus is abducens. In Zollinger-Ellison syndrome, the main manifestation is peptic ulceration. Which of the following types of immunoglobulins is the most responsible for promoting allergic reactions? IgE. Potassium is maximally absorbed in which part of nephron? Proximal convoluted tubules. Which one of the following sets of ions are necessary in the chemical events for muscles contraction? Calcium, magnesium ions. Calcium and magnesium ions. Ophthalmic artery is a branch of internal carotid artery. The fourth thoracic vertebra has the posterior longitudinal ligament between its body and the thoracic duct folds. Which of the following is not a primary target group of T cells? Toxins. Which gland control vessels metabolic rate? Thyroid. Difference between diastolic and systolic pressure is pulse pressure. The hardest material produced by the body is tooth enamel. The hardest material produced by the body is tooth enamel. In human body, unoxygenated blood is purified by lungs. Schwann cells are also called as neurolemanocytes. The trapezius muscles is located in the back. Insensible water loss per day is 700 ml. Stroke volume is a amount of blood ejected by each contraction of the ventricles. Lymph nodes receiving lymphatics from testes are para-erotic. Find out the correct statement regarding Bartholin's glands. All of the above. Homologous to bulbourethral gland in males, found posteriorly and to right and left of the opening of vagina. They secrete mucus. The spongy bones are called as cancellous. Melatonin is secreted by the pituitary gland. Which of those which of these substances hydrolyzes the dietary protein into amino acids? Trypsins. Which division of the nervous system initiates a response known as fight or flight? This is sympathetic nervous system. The pigment responsible for skin tanning is carotene. Length of female urethra is 4 cm. Terminal branch of internal carotid artery, anterior cerebral artery. Universal acceptor blood group is AB positive. When the nerve having Ellinger-Westphal nucleus as its component is oculomotor. A patient weighing 50 kg would be suspected of oliguria if the hourly urine output is 50 ml. All the following systems are involved in maintaining fluid and electrolyte balance except muscle system. Apical ectodermal ridge exerts an inductive influence on the limb mesenchyme to initiate the growth and development of limb bones. Apical ectodermal ridge. What is the product of rapid division but no overall growth during embryogenesis? Morula. Patella completely ossify by the age of 14 years. Number of bones in the skull is 22. Facial bone 14. The anterior abdominal wall veins above the umbilicus all drain into the portal system. Wrong. The inflammatory response is part of our innate immune response. Functions of epithelial tissue includes protection, secretion, absorption, all of the above answer. Graves' disease can result from an excess of thyroxine in the blood. Which of the following joints can move in only direction? Hinge joint. Only one direction. Hinge joint. Functions of the muscles of the abdominal wall may increase the intra-abdominal pressure for straining. True. Name of the hormone which takes part in the release of follicular stimulating hormone and luteinizing hormone from the anterior pituitary gland. GnRH. The smallest cranial nerve is olfactory. From the throat, ingested fluid liquids may pass into the trachea rather than the esophagus. In order to cease bleeding from an open wound, indirect pressure is applied to the affected artery which is proximal to the wound. Which of following order is correct about phases of mitosis cell division? Prophase, metaphase, anaphase, telophase. Pacemaker of heart is SA node. Which part of the male is responsible for sperm storage and maturation? Epididymis. A tiny blood vessel that allows for exchange between blood and cells in the tissue in the body is capillary. Which of the following is a connective tissue? Bone, cartilage, and blood. All of the above. Which of the following is associated with a B cell deficiency? Rutons, agamma-globulinemia. Anemia. Rectum develops from cloaca. Semicircular canals are present in inner ear. True about valves in portal venous system, whose system is valveless. Endocrine glands differ from exocrine glands in that endocrine glands are ductless and exocrine glands release secretion at the body's surface or into ducts. A vasectomy involves cutting the vas deferens. Which of the following is largest? Gluteus maximus. Vitamin K synthesis is done by clonic bacteria. Which of the following is not part of axial skeleton? Humerus. Auditory tube opens into nasopharynx. Folded appearance on the surface of cerebrum is known as gyri and sulci. Coagulation factor 7 is proconvertin. What is the third step in the blood flow path? Blood moves to the ventricles. What are the hormones' chemical messengers? What is the name given to the orifice through which fecal matter exits the body? Anus. Protein factory in human cells is ribosome. Which of the following does not develop from mesoderm? Pigment cells.